So yeah, oftentimes, when folks present to my office for let's just say a low back condition,
Hmm.
in oftentimes we'll find some other problems that are involving the hips,
Yeah.
whether it's an associated tendonitis or maybe a tendon tear, or some other lower extremity imbalance that can be sorted out along with the management of their lumbar condition. Oftentimes, the two are related.
For sure.
Very
Yeah.
often folks are dealing with some sort of an ailment, let's say in a knee or an ankle or something for some time, and that throws off their biomechanics, and then it works up that kinetic chain to their lumbar spine, and you end up with a lumbar issue that fires up as a secondary downstream sort of problem, and so we have to kind of put out the whole fire, and we do it in some sort of a sequence, and that's where physical therapy comes into play tremendously, and sometimes the interventions come into play as well to help calm things down, and in some cases really help moving towards healing. But yeah, I would say tendon injuries, muscle injuries of the extremities, whether it's a shoulder, a hip, um, hamstring. These things are common areas that I treat. Rotator cuff, all those sorts of areas I'll treat.
Yeah.
Even mild early, mild moderate, even osteoarthritis. Certainly in advanced cases of osteoarthritis, I turn to my orthopedic colleagues to
Yeah.
take the lead. But in earlier cases, there are some excellent non-surgical management strategies that are quite effective.
Okay.
And so it's all about understanding first and making a strong diagnosis. And then really things play out, from there in terms of options to move down a certain pathway of management.
That's great to know that it's not just like one part of the body that you work with, because sometimes certain specialists just specialize in like the elbow,